Well, now, Dr. Gary Kirsh is the president of the Urology Group in Norwood, the leading consumer healthcare fighters in this area relative to prostate cancer. He's also, this guy's busy, he's president of a national organization which is called the Large Urology Group Practice Association of America, with over 2,000 physicians nationwide, and he's the Barack Hussein Obama. He's the president. Dr. Gary Kirsh, welcome again to the Bill Cunningham Show.
Thank you, sir. It's always an honor.
Before we talk about the difficulties dealing with government and insurance companies, which is ruining the practice of medicine, friends of mine and have been told they have prostate cancer, or they're going to get prostate cancer, or they ought to go to Loma Linda. They ought to have it taken out. You shouldn't have it taken out. Have seeds put in. Have surgery. Don't have surgery. Dr. Alan Cordell, who's been my urologist for 25 years, said if you live long enough, you're likely to get prostate cancer down the road, sooner rather than later. What are the newest developments in the 21st century on the care and treatment of prostate cancer?
Well, Willie, there are several. First of all, we have a much better insight today as to who might need aggressive treatment for prostate cancer and who might not. So when you stated that lots of people will get prostate cancer in their lifetime, that's true. It's the most commonly diagnosed cancer in men after skin cancer. Now, what some people don't realize, it's also the number 2 cause of cancer death in men. So what we need to figure out, and we're doing a better job of, is if it's so common, lots of people have it but might not die from it. But on the other hand, a subset, number 2 cause of death in men, do die from it. How do we determine who needs the aggressive treatment and who doesn't?
All right, how do you do that then, Doc?
Well, we're doing a better job of that because we have a better understanding now based on cell types, based on some DNA analyses that we're doing with the cells as to which cells are more aggressive, and we're increasingly putting people on what we call active surveillance. What this means is they may have a little spot of cancer. It's very slow growing and mild, maybe not even ever a threat to them. And whereas in the past we would wheel them off and do surgery or radiation or something, now we're observing them by repeating biopsies and other tests longitudinally as opposed to intervening with treatments that have side effects.
So first, do no harm.
First, do no harm, Willie, is always the message in medical care.
Obama's plan has the effect of forcing prostate cancer patients to receive radiation and chemo in hospital settings instead of urologist's office. Why is that a bad idea?
Well, it's a bad idea because when you move things out of the urologist setting, especially a big group like ours that's well integrated, you cause the patient, the consumer, to pay more money because we're cheaper.
Yeah.
And furthermore, we have experts. We have a dedicated group of radiation doctors here. All they do here is treat prostate cancer. We have a dedicated pathologist here. All they do is understand the nuances on a slide, piece of tissue, of prostate cancer. When you try to take the patient away from centers of excellence, independent centers of excellence, such as the Urology Group, and there are other centers of excellence in this city in other specialties, then you're going to cause the patient to pay more money in a different setting, and they're going to get worse care.
Okay, so what stops this? Because I hear docs complain all the time about insurance companies and the government. Remember the good old days when you were in the business of patient care, not in the business of dealing with bureaucrats or dealing with insurance companies.
Yes.
Are the good old days ever going to come back?
Willie, those good old days are gone.
Oh, they're gone.
All we can do is try to preserve the quality aspects of our healthcare system that we have today and not let it erode any further.
So that's the best we can do is maintain the status quo.
Well, I think there's improvements that can be made, but we're not going to go back to the days where you had a corner doctor who had full control over the patient. Those days are gone.
I can remember the good old days when Dr. Clement, who was a general practitioner in Deer Park, would actually come to your house and go into my bedroom. He was there once or twice, give me some shot, and I got better. Are those days the bedside manner, that's done?
It's probably done. Willie, we may come in this country to a point where if people want that kind of service, they may be willing to purchase it. And that could happen. So, but the average insurance coverage or government coverage is not going to put Dr. Clement in your bedroom anymore.
And so have you thought, I know some have, of going to a concierge type practice in which someone pays, I don't know, $2,000 a year, and then you pay a little bit more every time you see a doc, and you have access to medical care and don't stand in line like a Greyhound bus station. Have you thought about doing that?
Well, our group has not. Now, as you know, other specialists or other primary care physicians in the market do that. The Urology Group, Willie, we serve 60 or 70% of the adult population for 2 million lives in our metro area. Our mission is to be the number one provider, the urologic backstop for this region. So we're not going to adopt a concierge model that will exclude people. But I think you'll see that increasingly in other specialties or in primary care, because frankly, people don't want to wait and be subjected to the types of insurance and government products that they're being subjected to. Some of them are willing to pay extra for better service, and like in many other areas of our economy.
Sure. Dr. Kirsh, what about kidney stones? I had one about 10 or 12 years ago. I was on a boat 250 miles north of Tahiti when it struck. I had blood in my urine. I was in pain. I thought, oh my God. It was like 2 o'clock in the morning. Never had blood in my urine before. I saw some French doctor on the boat at 8 o'clock in the morning who told me I probably had bladder cancer or kidney cancer. I said, oh my God. I took a plane. It was ugly to get back from north of Tahiti. It turned out to be a kidney stone. What can I do to avoid future kidney stones?
Drink a lot of water.
I got it right here, Doc. Right here. I got it.
Drink a lot of water.
How much water do I have to drink?
Well, you're supposed to drink enough water such that you produce about a half a gallon of urine a day out of your kidneys.
So that washes everything out.
Well, it dilutes the urine. So think of those stones. Think of high school chemistry, Willie. If you took a beaker of water and poured salt in it, it would dissolve. But at some point, you'd pour so much salt in it that it can't dissolve anymore. But if you go back and now double the amount of water in the beaker, it goes back into solution. So what you're doing when you're hydrating yourself is you're allowing those salts to stay dissolved and not clump into a stone.
What about gout, which is involved a little bit in uric acid? How can one, Dr. Joseph Temming, from Roger Bacon and Xavier, dealt with my gout in my big toe. Haven't had it since. Had it like 2 or 3 times. That's it. Do foods cause gout?
Well, you know, certain foods are, especially meat proteins, are high in the substances that lead to gouts and to kidney stones. And now for gout, there are, of course, medications, allopurinol and others, and sometimes we use those medications for kidney stones as well to cut down on those uric acid levels in the blood. But I'm not a gout expert, Willie.
All right, now, what about the future of male erections? One of the biggest thing in the world is Cialis and Viagra. Got these hot chicks walking around their bedroom barefoot, waiting for their man to take Viagra.
Yes, you may have those, and I respect you for it.
I don't have that happening to me personally, but do you believe in Viagra and Cialis? Is that the future of guys that can't get it up?
Well, it's absolutely not the future. It's the present, and we certainly believe in it because those drugs are very, very effective. Now, the problem is they don't work for everybody, and they're also, Willie, very expensive, and universally insurance almost never covers it.
I have a text here from my best friend, Wayne Carucci, also known as Vinny. He runs Gateway Distribution. He says, what about any improvement or advancement in the return of a higher PSA in prostate cancer? He talks about this freely, which I think is great. He had prostate cancer. They took the whole thing out. And then when the PSA goes up and up, what does that mean? What about hormonal therapy, stuff like that for someone that's already had prostate cancer?
Well, that's a great question, and I will tell you it could be the subject of a long discussion on another time, but in the last 5 years, we have seen a revolution in what's available miraculously to treat people with advanced prostate cancer. 5 years ago, we had nothing. Since that time, we have 4 or 5 new products. Immune therapy, something called Provenge. We've got some new pills. We have new radiation-type infusions, all things with much less side effects than chemotherapy. So we are making people who have advanced prostate cancer where the initial therapy has failed, as you mentioned, those people are doing better and better right now. Very well.
Correct me if I'm wrong. As I understand, the prostate's about the size of a plum, and that inside there is the seminal fluid, and every now and then cancer cells develop, grow inside. If you keep the cancer cell inside the capsule, you have a much better chance of survival than if the cancer cell gets out into your lymph nodes throughout the body. Am I right so far?
You are 100% correct, and you can eliminate that cancer inside the plum. Never heard it called a plum before, but you can eliminate the cancer inside the plum by either removing it or by using radiation therapy in the proper way.
If you had cancer inside the plum, would you radiate or get it taken out? Dr. Gary Kirsh, personally, what would you do?
Well, Willie, I can't answer that because, hell, I'm not in that situation. But the fact is, the statistics and the data are that both are probably equivalently effective. Now, there are some differences having to do with the tumor type and how much of the plum is involved in cancer and what the age of the patient is. But for the purposes of this conversation today, this is a very complicated area for the public and for patients because it really involves patient choice. And patients want to come to the doctor sometimes and have the doctor say, just like you just did.
I want to know.
You want to know, Doc, what is it going to be? And you know what I tell people? Unfortunately, it's like going to Graders. They give you vanilla chocolate, they give you strawberry, they give you butter pecan. You can't go up to the counter and say, tell me what I want. You have to understand the differences in these treatments, your own health condition, the side effects, the quality of life considerations, and you're going to have to make a choice. That's how prostate cancer is today.
Well, Dr.
It's
Kirsh,
not one size fits all.
I like to go to a doctor. I don't like to have a doctor say, on this hand you got this, and on that hand you got that, on this hand. I need a one-handed doctor.
Well, Willie, you need a doctor who's willing to give you a strong opinion when needed.
Yeah.
And willing to also give you education and help you make a decision when also needed.
So
that's what you need.
So if you've had prostate cancer and have had the plum removed and you have a rising PSA, what does that mean?
It means the cancer's not gone. It means the cancer got out before the plum was removed.
And so the key is to keep it inside.
Key is to find it early and have it removed early or have it treated with radiation. We use a machine here called CyberKnife. We've talked about it before.
Yeah.
Very advanced radiation, only 5 treatments necessary. So you have it treated one of these ways, and hopefully you kill it before it gets out of the plum. Once it's out of the plum, all bets are off.
Well, then Uncle Woody's a problem in the future, correct?
Uncle Woody can be jeopardized, yes, sir. But then we come back to those medications, and we also have other treatments that we can use for erectile dysfunction. I always tell my patients, Willie, we can get your erectile dysfunction back. That's not the issue. The question is, which kind of hoop do you want to jump through to get it back? I mean, we can go as far as surgical implants, and we can get your sex life back.
Well, in my case, I had a PSA that was like a 2, 2.5. It got up to like a 3.6. So Dr. Cordell, with you, said, well, we better test this every 90 days. So I went back, and it fell from a 3.6 to a 3.2 to a 2.8. Now it's a 2.2. Is that a good thing?
Yes, it's a good thing. You're in good shape. You don't have to worry about that PSA. It's in the normal range. You're not an old man, certainly, but you're not 40, so you're in good shape, and you don't need it every 90 days anymore. You're fine.
What about an enlarged prostate? Is that a problem or not? Getting up middle of the night to pee.
Yeah, that's a problem if it bothers you. Now, the prostate size in of itself is not a problem. What's a problem is if the growth of the prostate compresses the urinary tract such that you don't have adequate urinary habits. They bother you. You got a weak flow. You're getting up too much at night. That's a problem. Then we help you.
Dr. Gary Kirsh of Urology Associates, you have any questions for me about sports, politics, world capitals, meteorology, something that's confused you over the years?
I want to know when the snow is going to end on the East Coast this year, Willie.
According to Chuck Ingram sitting to my left, he says by the time of the Boston Marathon, the snow should be down to about 14 feet.
That's all I needed. Thank you.
And thank God we have global warming. Imagine how bad it would be without that.
That's a good point.
Gary Kirsh, you're the best there is, and God bless America.
Thank you for the time, Willie. I always enjoy it.
Thank you. And that's Urology Associates. Urology Associates.